आई होप अब तो रिलैक्सेशन हो गया है। So I hope I can see the students. Students are there. So we'll be just recalling the questions which were asked in the subject of pediatrics. And first of all, I say this is a recall. So not necessarily exactly the same questions. These are the type of the questions which we get particularly here. So let's start with the first question. कोई भी if you can correct me कि सर ये exact नहीं था, ऐसा question नहीं था, तो that's most welcome please. There was a question, a child with a single palmar transverse, actually should be single transverse palmar crease and low set ears is most likely to have which of the following abnormality, right? देखिए, if this was the only question and this was the only line, single transverse palmar crease and low set ears, and these are the choices given, then it is most likely a case of the Down syndrome. It is the most likely a case of the Down syndrome. If this was particularly the choices given, that is the single transverse palmar crease which is being given, and there is low set ears, and these choices are given. Because if I tell you single transverse palmar crease and low set ears is also seen in Cri-du-chat syndrome, and in Cri-du-chat syndrome basically there is deletion of chromosome 5. So agar choices were exactly the same, that means it is not Cri-du-chat, this is Down syndrome. And if you had to choose that which of the following, so ideally speaking it is an aneuploid, there can be mosaicism, there can be Robertsonian translocation, all three can be there. तो अगर क्वेश्चन में एक्सेप्ट नहीं था, now if I tell you basically this is our regular batch notes what we particularly teach you there, and what you tell you that in 95% of cases there is complete trisomy, in 1 to 2% there is mosaicism, and Robertsonian translocation is seen in 3 to 4%. So in the Down syndrome, this is basically our workbook only for the FMG students. So basically what we get is there is complete trisomy, there is mosaicism, there is Robertsonian translocation, but out of this the 95% of cases there is complete trisomy. And if you can see in the hand below, we basically show a single transverse palmar crease, that is the simian crease, and this is the low set ears which is being written, right? So if this was the question asked and these are the choices given, so out of the three, the most common should be aneuploidy. Because what is aneuploidy? Aneuploidy is the abnormal number of chromosomes. Abnormal number of chromosomes which are not exact multiple of haploid number, which are not exact multiple of the haploid number. This is aneuploid. So basically what we mean to say, they can be 2n plus 1, 2n minus 1, 2n plus 1 and 2n minus 1, right? And when we say sir yahi tha Gagan Chaudhary, triploidy was not given, but short stature or mental retardation, I think Ankita that was in a different question. Micronathia, that was in a different question जो मेरे पास पहुंचे हैं क्वेश्चंस, उसी की बात कर रहे हैं, that this was particularly the questions if we go for here, right? So 2n plus 1 आपका ट्राइजोमीज होते हैं 47, 2n minus 1 आपके मोनोजोमीज होते हैं. So if this was particularly the question which was given, then your answer should be what? NEUPLID. Out of this, the most appropriate one I am taking. That is NEUPLID, right? And provided choice में deletion नहीं था क्योंकि ये दोनों features single transverse palmar crease and low set ears is particularly also seen there, right? So triploid नहीं था तो आप इसको बेसिकली टेट्राप्लॉइड कह सकते हैं, हैप्लॉइड कह सकते हैं, तो वो भी आंसर नहीं है। अगर मान लीजिए ये नहीं था तो आउट ऑफ द थ्री चॉइसेस, बिकॉज यू कैन वेरी वेल सी कंप्लीट ट्राइजोमी 95% में है, मोज़ैकिज्म 1 to 2% में है, रॉबर्टसोनियन ट्रांसलोकेशन 3 to 4% में है, राइट? आई होप दिस इज ओके क्वेश्चन हियर, राइट? सेकंड क्वेश्चन पे चलते हैं। Day 4 child came with history of yellowing of skin and serum bilirubin is 15. There is history of weight loss present, right? Now, if this is only such history given, if only this history is given, you cannot comment upon anything and you need to assume this is physiological, right? But if it is given, the child was given less of the feeds या फिर weight loss जो है that was more, then it could be breastfeeding failure jaundice. So if you can comment upon, मतलब अगर simple इतना है, क्योंकि we all know what are the features of the physiological jaundice. The features of the physiological jaundice are, it is never present in first 24 hours after birth. It is never present in first 24 hours after birth is there. That is one thing. There is increase in unconjugated bilirubin. जो मुझे क्वेश्चन मिला है वो सिर्फ यही क्वेश्चन मिला है। अगर आप इसमें कोई करेक्ट कर पाए तो इट विल बी वेरी वेरी गुड कि कोई सिग्निफिकेंट वेट लॉस की हिस्ट्री थी या नहीं थी। इंक्रीज इन अनकॉन्जुगेटेड बिलिरुबिन एंड दिस कैन परसिस्ट up to day 14 in a term child and day 21 in preterm child. Right? But if it was particularly given that there is significant weight loss, right? देखिए up to 10% weight loss first 10 days में permissible है, लेकिन अगर इससे ज्यादा weight loss है और child में jaundice है, then you should think of the breastfeeding failure jaundice. Right? कोई कमेंट नहीं कर रहा है, कोई बताएगा? स्टेफ ऑरियस, अंकिता, रघवेंद्र, गगन, will anybody tell me, was the same question? Was anything being given there? Right? Then moving on to the, following you, अमान खान, मोनोजोमी किसमें था? अंकिता, yes sir, following you, okay. Then was a one more question then was there too. Monozomy should be put there. इसमें से मतलब किसी एक चॉइस में मोनोजोमी था. You are saying this. It's the same question. Okay, thank you अंकिता. तो अगर ऐसा ही मेंशन था ना, कोई सिग्निफिकेंट वेट लॉस मेंशन नहीं था, तो आपका आंसर पर्टिकुलरली फिजियोलॉजिकल है. गोइंग ऑन टू क्वेश्चन नंबर 3, 29 वीक gestation with heart rate less than 100, saturation in right upper limb is 80%. Next step is to start, right? This is according to the recall I have got from the students कि ये वाला क्वेश्चन था, right? So if we consider this question, heart rate less than 100 is an indication to start positive pressure ventilation. It is an indication to start positive pressure ventilation. देखिए एग्जैक्ट लैंग्वेज तो सेम नहीं हो सकती, बट आई होप द सेम फीलिंग शुड बी देयर, मतलब एग्जैक्टली जो पूछा गया था उसकी बात करें. एंड यू नीड टू गिव इज ऑक्सीजन एंड लेस देन 35 weeks of age. The amount of oxygen given is 21 to 30%. The amount of oxygen given is what? 21 to 30%. And more than 35 weeks, you start with the room air. You start with the room air. तो अगर क्वेश्चन में 29 वीक्स जेस्टेशन है, हार्ट रेट लेस देन 100 है, तो आपका आंसर आना चाहिए पॉजिटिव प्रेशर वेंटिलेशन with 21 to 30% oxygen. Positive pressure ventilation with 21 to 30% oxygen. Right? I hope this was the question there. Okay, we need to start the positive pressure ventilation with 21 to 30% oxygen. Right? If anybody can respond more, it will be too good. Then this was a question. Child is born to a mother with gestational diabetes. Child is found to be lethargic, poor cry and feeding after birth. 100% option was there. 100% तो आप देंगे ही नहीं. Cinema sickness will not give 100%. 100% oxygen, so you only give on chest compression. If I correct here, right, 100% oxygen is basically there if you are starting the chest compression. If the heart rate is particularly less than 100, if the heart rate is particularly less than 100, so in that case particularly, heart rate is less than 100, then in that case particularly, we need to start positive pressure ventilation, right? So I hope ये तो question जिसने भी notes पढ़े definitely everybody must have marked correct. Then this was a question. A child is born to a mother with gestational diabetes. Child is found to be lethargic, poor cry and feeding. Right? एक child है जो आपका infant of diabetic mother है. This again is our FMG notes and what I teach there. जो basically fetus में दो चीजें होती हैं. एक fetus में hyperglycemia होता है. एक fetus में there is hyperinsulinemia. And due to insulinemia, the insulin is the major hormone causing intrauterine growth, so there should be large for gestational age or macrosomia. Second, अगर insulin ज़्यादा है, there should be hypoglycemia. Third, insulin की वजह से hypocalcemia. Insulin also stimulates erythropoietin production, जिससे polycythemia और polycythemia है. Good Ankita. Good Ankita, you marked right. Very, very good. So this is neonatal jaundice, renal vein thrombosis, right? So this all thing can be seen due to what? Fetal hyperinsulinemia. This is due to the fetal hyperinsulinemia. Clear enough? तो अगर हम यहाँ बात करें fetal hyperinsulinemia, right? So there is particularly hypoglycemia. अगर child lethargic होता है, what we teach, अगर child lethargic है तो first investigation, right, is to be gone for blood sugar. और अगर neonate में ऐसा है, the neonate is not accepting feeds, you should rule out neonatal sepsis. You should rule out neonatal sepsis there, right? So here, what we say here, your answer should be straightforward, hypoglycemia. Rest all the things can be seen, but due to polycythemia, what can be seen? Increased incidence of neonatal jaundice. Increased incidence of neonatal jaundice. इसकी वजह से increased incidence of renal vein thrombosis. Renal vein thrombosis. Hypocalcemia की वजह से there can be seizures. There can be seizures. So therefore, what we say practically, in every infant of a diabetic mother, which two investigations should be done at birth? In every infant of diabetic mother, two investigations are must. One is blood sugar and second is the serum calcium level. ये दोनों investigations birth पे करना must है. One is the blood sugar and second is the serum calcium levels. Serum calcium levels is there. राइट। आई होप ये भी सबने सही मार्क किया बिल्कुल। Then there was a question, 2-year-old child with mid upper arm circumference of 105. 105 is accepting feeds well, the child will be classified as. Now SAM तो या pneumonia हो या nephrotic हो, ये तो कुछ important topics हैं which are always asked in the FMGE exam. तो SAM में what we say, mid upper arm circumference is less than 11.5 centimeter, or what we say, there is bilateral and symmetrical edema which is there, or this is particularly weight for height Z score. Weight for height Z score is less than -3. That is less than -3, right? और important word क्या है, इन तीनों में बीच में और है. So all the three criteria is not required. Yes, Steph, you are absolutely right. The child is accepting feeds well. Child is accepting feed well. So this simply becomes is the uncomplicated SAM. This becomes is the uncomplicated SAM. Now what all complications can you see in the SAM? The complications which you see in the SAM, you remember by the mnemonic shielded. You remember by the mnemonic shielded. S का मतलब शुगर, शुगर का मतलब होता है हाइपोग्लाइसीमिया, आप रूल आउट करते हैं. H is for hypothermia. I is for infection. EL is for electrolyte imbalance. Electrolyte imbalance. D is for dehydration. And last D is deficiencies. Last D is deficiencies. Right? तो child में कुछ भी नहीं है. Right? I hope rest all choices are also the same. If anybody can tell me कि जो और choices थी were they same or not? Right? Good. I hope most of them have marked the correct answers. और ये क्वेश्चन तो बिल्कुल स्ट्रेट फॉरवर्ड क्वेश्चन है. क्रॉनिक मैल न्यूट्रिशन का मार्कर क्या है? हाइट फॉर एज, विच इज ऑल्सो अ मार्कर ऑफ स्टंटिंग. मार्कर ऑफ स्टंटिंग दैट इज HAS. ज्यादा कंफ्यूजन हो जाए तो हमेशा वर्ड याद रखो, हैज. हाइट फॉर एज इज इक्वल टू स्टंटिंग. हाइट फॉर एज इज इक्वल टू स्टंटिंग. वेट फॉर एज, यस, वेरी गुड. वेट फॉर एज दोनों का मार्कर होता है बोथ एक्यूट एंड क्रॉनिक मैलन्यूट्रिशन. वेट फॉर हाइट सिर्फ एक्यूट मैलन्यूट्रिशन होता है. एंड बॉडी मास इंडेक्स इज लेस देन 18.5. और बेस्ट मार्कर जो मैलन्यूट्रिशन का है दैट इज पर्टिकुलरली वेट फॉर एज. दैट इज द वेट फॉर एज इज देयर. वेरी गुड अंकिता, बस करेक्ट ही आंसर याद रखना है, बाकी तो गलत हो जाए उससे हमें कोई चिंता ही नहीं करनी है. वी आर नॉट बॉर्डर अबाउट दैट. राइट. इसके तो मुझे चॉइसेस ही नहीं मिला. 2-year चाइल्ड है, बोइंग ऑफ द लेग्स है, हाई एल्कलाइन फॉस्फेटेस है, नॉर्मल कैल्शियम है और इंक्रीज PTH है. राइट. मोस्ट लाइकली डायग्नोसिस एल्कलाइन फॉस्फेटेस इंक्रीज्ड, कैल्शियम नॉर्मल, PTH इंक्रीज्ड. The diagnosis should be in the favor of Rickets. और so called एक एक्सरे था, एंड आई होप कुछ ऐसे ही एक्सरे था जिसमें बोइंग ऑफ लेग्स है. जब भी रिकेट्स होता है, व्हाट आई ऑलवेज टीच यू, PTH का लेवल बढ़ता है. और PTH बेसिकली के 3 रोल होते हैं बॉडी में. PTH क्या करता है? दिस स्टिमुलेट्स 1-alpha हाइड्रोक्सिलेज. PTH स्टिमुलेट्स करता है 1-alpha हाइड्रोक्सिलेज, और उसको अगर स्टिमुलेट किया तो कैल्सीट्रायोल का लेवल बढ़ जाता है. और कैल्सीट्रायोल का लेवल बढ़ा तो कैल्शियम एब्जॉर्प्शन इंक्रीजेस. दूसरा होता है रिलीज ऑफ कैल्शियम फ्रॉम बोन्स. कैल्शियम बोन से आता है. अगर कैल्शियम पर्टिकुलरली बोन से आया तो बोन्स में ऑस्टियोब्लास्टिक एक्टिविटी बढ़ती है, और अगर ऑस्टियोब्लास्टिक एक्टिविटी बढ़ती है तो एल्कलाइन फॉस्फेटेस का लेवल बढ़ता है. there is increased alkaline phosphatase. Third, PTH goes in the kidney, और किडनी से ये क्या करता है, increased reabsorption of calcium, increased reabsorption of calcium, तो यूरिन कैल्शियम कम हो जाता है. On the other hand, there is decreased reabsorption of phosphorus. तो बेसिकली यूरिन फॉस्फोरस बढ़ता है और सीरम फॉस्फोरस कम हो जाता है. सो व्हाट यू शुड ऑलवेज रिमेंबर, अगर नॉर्मल रिकेट्स है तो पीटीएच तो बढ़ेगा ही बढ़ेगा. नॉर्मल रिकेट्स है तो पीटीएच तो बढ़ेगा ही बढ़ेगा. एंड अ लाइन यू शुड ऑलवेज रिमेंबर, नॉर्मल पीटीएच लेवल, normal PTH level excludes the diagnosis of vitamin D deficiency. Normal PTH level excludes the diagnosis of the vitamin D deficiency. Right? बाकी चॉइस तो मुझे भी नहीं पता. If you can tell me rest of the choices, I can fill. But I hope ये क्वेश्चन मुझे नहीं लगता किसी ने गलत किया होगा. Every student must have marked this right answer. Next one, newborn intrauterine infection. I taught you regular batch, maybe we always taught in the DFX also, and there was particularly 2 questions this time. A question tha osteogenesis imperfecta. Okay, I fill here one option, osteogenesis imperfecta. Very good, Ham Akhtar. Very good. If you can recall the options, this is the C options, so that when we record next time in the app तो हमारे पास सारे options हो. Newborn is having macrocephaly, intracerebral calcification, chorioretinitis. Straight forward answer है, classical triad है, और उस classical triad के अंदर it is toxoplasma. Toxoplasma में what you study is hydrocephalus मिलता है. Toxoplasma में there is intracerebral calcification, और टॉक्सोप्लाज्मा में there is chorioretinitis. ये क्लासिकल ट्राइड है which is particularly seen here. साइटोमेगेलोवायरस में यूजुअली आपको मिलता है माइक्रोकेफेली with periventricular calcification. Periventricular calcification. अंकिता, आई होप यू आर सेइंग फॉर द लास्ट क्वेश्चन, तो मैं उसका नोट कर लेता हूं. डी चॉइस बेसिकली नोट कर लेता हूं, हाइपोथायरॉयडिज्म थी. तो आई होप इसमें भी मुझे लगता है किसी ने कोई गलत क्वेश्चन किया है. माय वॉल्यूम इज लो, आई डोंट अंडरस्टैंड, आई एम शाउटिंग लाइक एनीथिंग. If I have to do something, I hope my mic is going well. And if I touch something, this might do the problems. I think you increase your volume. बाकी सबको भी वॉल्यूम कम आ रही है. लो वॉल्यूम आ रहा है. Okay, just wait, if I can do something. Now see, volume has increased something. Now is the volume okay? क्या वॉल्यूम ओके हुआ कुछ? नित्या, बारी हसन, is the volume okay now? I hope now the volume should be okay. Okay, now it is okay. Good. नेक्स्ट क्वेश्चन पे चलते हैं. ये भी स्ट्रेट फॉरवर्ड क्वेश्चन था. एक चाइल्ड में देयर इज पेटेंट डक्टस आर्ट्रियोसिस, देयर इज प्रेजेंस ऑफ कैटरैक्ट एंड सॉल्ट पेपर रेटिनोपैथी. अ स्ट्रेट फॉरवर्ड आंसर ऑफ द रुबेला में बेसिकली what you get is PDA, what you get is cataract, what you get is salt pepper retinopathy. and you should also remember the late complications of rubella. In that particularly there can be glaucoma also, there can be thyroid dysfunction also, thyroid dysfunction also, there can be diabetes, there can be diabetes, and there can be progressive rubella panencephalitis, progressive rubella panencephalitis. And rubella अकेला इन्फेक्शन है, राइट, rubella अकेला इन्फेक्शन था, particularly which cannot be treated. Toxoplasma can be treated, cytomegalo can be treated, herpes can be treated. I am talking out of the torch infection, but rubella को आप treat ही नहीं कर सकते. So what you particularly say, mother has rubella. If particularly mother has rubella and the pregnancy is less than 20 weeks of gestation, less than 20 weeks of gestation, we go for termination of pregnancy. और अगर मदर को रुबेला है and that is more than 20 weeks of gestation, we go for the continuation of pregnancy. We go for the continuation of pregnancy. This all we have covered in our notes, right? ये बिल्कुल हमने रेगुलर बैच और DFX दोनों में दोनों पॉइंट्स कवर किए थे. Out of the following, increased upper to segment ratio is seen in all except. अब इस क्वेश्चन पे बहुत कंफ्यूजन है, कोई कहता है एक्सेप्ट था, कोई कहता है एक्सेप्ट नहीं था, पर डेफिनेटली एक क्वेश्चन तो था. और कुछ ऐसा भी बता रहे हैं कि 90 सेंटीमीटर 3 इयर्स पे दिया हुआ था और अपर सेगमेंट 45 सेंटीमीटर, कुछ ऐसे दिया था क्वेश्चन. माइट बी कि 3 इयर्स पे 90 सेंटीमीटर and upper segment was given particularly 45 centimeter, right? कुछ ऐसा कह रहे हैं, कोई क्वेश्चन ऐसा कह रहे हैं. I do not know exactly what was being asked, right? But this is something we teach you, right? This is something I teach in our regular batch for FMG students, and I always say infantile body proportion आपको 3 जगह मिलता है. और इन्फेंटाइल बॉडी प्रपोर्शन का मतलब होता है अपर सेगमेंट इज मोर देन लोअर सेगमेंट. दैट इज सीन इन रिकेट्स, दैट इज सीन इन achondroplasia, दैट इज सीन इन hypothyroidism, दैट इज सीन इन दी hypothyroidism, राइट? ये बेसिकली दैट इज सीन एट 3 places. दिस इज सीन एट 3 places. विल somebody करेक्ट मी, ये क्वेश्चन था और किस फॉर्म में था? Step 4, yes, you are saying 45 centimeter upper segment except was not there. मोहम्मद रहीम, what you are saying, no sir, मतलब ये क्वेश्चन ऐसे था 3 years 90 सेंटीमीटर, अपर सेगमेंट 45 और लोअर सेगमेंट 45. ओके, तो इसका मतलब 3 years पे 1:1 हो गया, जबकि बर्थ पे कितना होता है? बर्थ पे होता है 1.7:1. 3 years पे 1.3:1, 5 years पे 1.2:1, 7 years पे 1.1:1, 10 years पे 1:1. तो 3 years पे मिलना चाहिए था 1.3, राइट? एंड मिल गया हमें 1:1. अगर 1:1 है तो इसका मतलब लोअर सेगमेंट जो और अपर सेगमेंट दोनों बराबर हैं. सो दैट इज नॉट इन्फेंटाइल बॉडी प्रपोर्शन. तब इसका आंसर बनना चाहिए, अगर एक्सेप्ट भी नहीं था और ऐसे क्वेश्चन था तब भी इसका आंसर बनना चाहिए स्पॉन्डो एपिफिजियल डिस्प्लेजिया, बिकॉज इन तीनों के अंदर तो अपर सेगमेंट इज मोर देन लोअर सेगमेंट. इन तीनों में तो अपर सेगमेंट इज मोर देन लोअर सेगमेंट, राइट? तो अगर क्वेश्चन ऐसे भी था ना कि 3 years पे बोथ अपर सेगमेंट लोअर सेगमेंट आर इक्वल टू वन अनदर, देन इट कैन नॉट बी achondroplasia, it cannot be hypothyroidism, it cannot be rickets. तो अगर बेसिकली क्वेश्चन को हम रिफ्रेम करें, we are saying is 3-year child, we are saying here 3 years child and the height of the child is 90 centimeter, 90 centimeter, and upper segment is 45। ये था क्वेश्चन, तब भी आपका आंसर चॉइसेस अगर ये थी तो यही वाला था, स्पॉन्डो एपिफिजियल डिस्प्लेसियास। क्लियर? अगर आपने थोड़ी सी भी नोट्स पढ़ो, देखो व्हाट आई टीच यू, ऑलवेज फॉलो मेथड ऑफ एक्सक्लूजन। भाई ये नहीं है, ये नहीं है, ये नहीं है, जो बच गया वो आपका आंसर है, राइट? गुड स्टेप फॉर यस, mark the right answer, very very good. Blood sample for screening of congenital hypothyroidism should be taken at. Blood sample for screening for congenital hypothyroidism should be taken at. This is what I teach you in my regular batch. Normal hospital delivery at term, you measure T4 and TSH between 2 to 4 days after birth. 2 to 4 days after birth. And you should, अगर choices आपको ऐसे दे रखी थी, cord blood within 24 hours, 48 hours, तो आपका बेस्ट आंसर क्या है? 72 hours. आपका बेस्ट आंसर क्या है? 72 hours, because in the first 48 hours, in the first 48 hours, right? In the first 48 hours, if you particularly see, TSH level can increase, right? And this becomes normal within 2 days. अगर ये TSH है यहाँ पर, तो ये TSH का लेवल बढ़ जाता है in a child in response to cold stress. In a child in response to cold stress. So in response to cold stress, TSH level increases, and this, and I will be taking live face-to-face lecture which is scheduled. I don't know if it is scheduled in Feb or when, but whenever it is scheduled, I will be taking. This is in response to the cold stress, the TSH level increases, and this becomes normal within how many hours? 48 hours, right? So therefore, we should measure at which hours? 72 hours. We should measure at 72 hours. According to me, that is the right answer. Next one, बहुत favorite one topic है, pneumonia. 3-month-old child, respiratory rate of 52 per minute, no chest in drawing, child is having difficulty in breathing, the child will be classified as heavy, right? What we teach, if there is fast breathing, if there is fast breathing and or chest in drawing, there is fast breathing and or chest in drawing, that is something which we call as pneumonia. That is something which we call as pneumonia. या तो फास्ट ब्रीदिंग है या चेस्ट इन ड्रॉइंग है या दोनों प्रेजेंट है, that is something you call it as pneumonia. And pneumonia is basically what we say, you give oral amoxicillin for 5 days. You give oral amoxicillin for 5 days. तो यहाँ पर फास्ट ब्रीदिंग है क्योंकि 2 to 12 months के बीच में, 2 to 12 months के बीच में it is more than 50 per minute, which is considered to be fast breathing, right? 55 ले लो स्टेफ ऑरियस, तब भी आंसर निमोनिया है. 52 ले लें तब भी निमोनिया है. तो ये तो आपका सबका ही आई होप आंसर ठीक होना चाहिए. कफ ले लो, उससे फर्क नहीं पड़ता मान खान, कफ हो, फीवर हो, डिफिकल्टी इन ब्रीदिंग हो, क्योंकि यहाँ पर आप चलोगे अकॉर्डिंग, यू विल गो पर्टिकुलरली अकॉर्डिंग टू द IMNCI. You will go to the integrated management of neonatal and childhood illness. So you will particularly go according to the IMNCI classification. Next, I hope ये भी एक क्वेश्चन था which is many saying this might have discussed in pathology also. 3-year-old child, mentally retarded, fatty child has the paternal gene deletion of the chromosome. So if this was particularly the question, you are talking of the phenomenon of genomic imprinting. Genomic imprinting. And imprinting basically means silencing of gene. Silencing of gene. और ये imprinting is something a normal phenomenon. ये कोई abnormal phenomenon नहीं होता है. and this can be seen with the chromosome number 15. So in this question, we will come to that. This is most likely Prader-Willi syndrome. Prader-Willi syndrome, involvement of the gene SNORP gene. SNORP gene is there. So if we consider here कि ये आपका फादर का क्रोमोसोम है पैटर्नल, ये मैटरनल क्रोमोसोम है. This gene is active on father chromosome and this gene is imprinted on mother chromosome. ये normal है. This is no disease. So I am coming. Steph, if it was that condition, that will also come. The same चीज आ जाएगी. तो पैटर्नल के ऊपर ये एक्टिव है और मदर पे ये इम्प्रिंटेड है और इम्प्रिंटिंग इज समथिंग विच इज अ नॉर्मल फिनोमिना. ये डिजीज नहीं है. नाउ हाउ विल द डिजीज टेक प्लेस? Disease will take place if there is deletion of paternal gene, because active जो है ना, normally it is producing protein which is sufficient for the body. If that active gene is lost, there will be particularly the disease. So why we say Prader-Willi syndrome? Prader-Willi syndrome is due to deletion of paternal chromosome, क्योंकि active gene को जाना है. Or the second reason can be maternal uniparental disomy. Maternal uniparental disomy. So of course the answer will be Prader-Willi syndrome only. और अगर paternal deletion दिया हुआ था तो I have explained here the answer. Saurabh, Steph, Aman, you have all marked correct. Very, very good. You have all marked the correct answer. Very good. Child 1 year of age has history of recurrent infection by Staph aureus. There is decreased serum IgA, IgG, IgM and IgE. Out of the following disorder is, right? So in our body basically what you study, एक pre B cell है जो convert करता है B cell में, which gets converted to plasma cells. यहाँ जो pre B cell में convert करता है, there is the enzyme tyrosine kinase और यहां पर आपका फैक्टर है BAF. If there is mutation of this tyrosine kinase, there will be no B cell, there will be no plasma cell. So what will happen? There will be decreased. Okay, that's very, very good. That's very, very good. अगर इसमें दे रखा था also decreased B cells. भाई प्री बी सेल में कन्वर्ट होता है, बी सेल से प्लाज्मा सेल बनते हैं. लेकिन अगर टायरोसिन काइनेज पे म्यूटेशन है, प्री बी सेल इज नॉट कन्वर्टेड टू बी सेल, सो देयर इज डिक्रीज इन ऑल इम्यूनोग्लोबुलिन्स. देयर इज डिक्रीज इन ऑल इम्यूनोग्लोबुलिन्स, मे बी IgG, IgD, IgE, IgM, IgA, राइट. एंड इन दिस अगर कुछ भी नहीं है तो there is mainly infection by this Staph aureus. So this is most likely Bruton's disease, which is a X-linked recessive disorder. X-linked recessive disorder. So according to me choice में आपको boys भी दिया होगा. According to me boy भी दिया होगा, child की जगह boy of 1 year of age दिया होगा. Then particularly this usually manifests after 6 months. This usually manifests after 6 months when maternal antibodies disappears. This manifests after 6 months when maternal antibodies disappears, right? In the D-George syndrome, there is particularly absence of third and fourth pharyngeal pouches. और अगर थर्ड और फोर्थ pharyngeal pouches absent होते हैं तो absent thymus gland होता है. And if there is absence thymus gland, there is decreased T cells. So B cells तो नहीं होते, ruled out. Chronic granulomatous disease. Chronic granulomatous disease is deficiency of the enzyme NADPH oxidase. NADPH oxidase. But here neutrophils are not able to kill the bacteria. Immunoglobulins are normal. जो आपका अटेक्सिया टेलेंजेक्टेसिया है, अटेक्सिया टेलेंजेक्टेसिया में देयर इज डिक्रीज इन IgA, IgG, IgE, ये तीनों डिक्रीज कर जाती है. So there is decrease in IgA, IgG, IgE. They all three are decreased. Very true, Stephorius. Clear? लेकिन आप वहां पर चॉइस में क्या दे दिया था? Absence of B cells. So वो absence of B cells अगर दिया है तो definitely your answer is Bruton's disease. Definitely your answer is the Bruton's disease. Next one, an infant or after multiple episodes of diarrhea presents with an erythematous lesion as shown. Which deficiency? Of course a straightforward answer, zinc deficiency. और जो zinc deficiency होती है ना, this can be congenital, this can be acquired, this can be acquired. Congenital you study in the acrodermatitis enteropathica, acrodermatitis enteropathica. And acquired can be seen in a premature child, prematurity. डाइट्स के अंदर ऑक्जेलेट्स हैं और फाइटेट्स हैं. So due to oxalates and phytates, zinc is not absorbed, right? And this zinc particularly actually is a component of zinc finger protein. And zinc finger protein is required for the growth and differentiation. Growth and differentiation. Zinc is also a part of cell mediated immunity. Cell mediated immunity. तो दो चीजों पे फर्क पड़ता है जिंक पे, एक तो ग्रोथ पे फर्क पड़ता है, और अगर पर्टिकुलरली ग्रोथ पे फर्क पड़ता है तो स्किन फीचर्स बहुत कॉमन होते हैं. एंड दिस स्किन फीचर्स आर प्रेजेंट इन पेरीओरल एंड पेरिनियल एरियाज. पेरीओरल एंड पेरिनियल एरियाज. और ये जो होते हैं पर्टिकुलरली दे आर bilateral and symmetrical. They are bilateral and symmetrical. And what is most important to be remembered, acrodermatitis enteropathica. What does it mean? This basically means inability to absorb, inability to absorb sufficient amount of zinc, inability to absorb sufficient amount of zinc, right? It is not that the zinc is not absorbed. Acrodermatitis enteropathica में आप पेशेंट को 3 मिलीग्राम पर केजी पर डे जिंक देते हैं लाइफ लॉन्ग. नॉर्मल एक्वायर्ड में तो 0.5 to 1, but acrodermatitis enteropathica means inability to absorb sufficient amount of zinc. Then one of the questions, 5-year-old child who is a son of a migrant worker, unvaccinated, was brought with history of fever and rash. Examination of the eyes, bited spots is seen, right? Unvaccinated child है, fever with rash है, vitamin E deficiency के signs हैं, तो हमारा diagnosis measles है. अब already measles हो गया, that means particularly this is not required, and here should be measles vaccine. This is not required, right? Now in this child, hospitalization and antibiotics, nothing to suggest that there is pneumonia or any other features. So the other child should not have this feature. So what we should do, isolation and vitamin A supplementation. Isolation and the vitamin A supplementation. So this is something we say, isolation and the vitamin A supplementation, which is done. Next one, ये भी बहुत सिंपल है. A patient presented with gum bleeding, petechiae, poor wound healing. Straightforward answer. मुझे नहीं लगता किसी ने गलती की होगी. Vitamin C deficiency, because vitamin C is required for collagen synthesis, and vitamin C causes hydroxylation of proline and lysine. Hydroxylation of the proline and lysine, right? So this helps in basically what? Collagen synthesis. So therefore we say gum bleeding, petechiae, poor wound healing. Clear? all these features, क्योंकि बिल्कुल स्ट्रेट फॉरवर्ड क्वेश्चंस थे and I don't feel like कि आप में से किसी ने इसको गलत किया है. Now this was a question which the students were saying, child presented with micrograthia and low set ears, these clinical features. देखिए, if it is given a small chin, it is given the low set ears, these particularly are the features of Cri-du-chat syndrome. Cri-du-chat syndrome. Cri-du-chat syndrome में is a small chin. There is low set ears which is present, right? And this is due to deletion of chromosome 5. This is due to deletion of chromosome 5, short arm 5p minus, deletion of the short arm of chromosome 5, deletion of short arm of chromosome 5. There is cat-like cry in infancy. cat-like cry होता है infancy में, लिखते हम chat हैं पर actually में there is a cat-like cry in infancy, right? So if you see out of this, what should be the right answer? It should be deletion. Other features जो यहाँ मिलते हैं in Cri-du-chat syndrome, there is microcephaly, there is hypotonia, low set ears already आ गया है, यहाँ पर भी मिलता है single transverse palmar crease. The same single transverse palmar crease which you get in the Down syndrome is also seen here. The only difference is in the eyes. There is downward slant of palpebral fissure. This downward slant of palpebral fissure is something which is called as the anti-Mongolian slant. This is called as the anti-Mongolian slant. So this is the downward slant of the palpebral fissure. देखो, teachers Collins syndrome, if you particularly see, it is given in the choice there. Sorry, what the same given deletion, inversion, translocation, amplification. Janmijay Singh. Because pointed chins and low set ears, right? Only these two can be multiple. I can give you multiple examples. But first thing, according to the choices I have chosen my answer, there can be Cri-du-chat syndrome. Out of the following, drug preferred for treatment of meningitis. Right now you say this question, this is what I teach there you in regular batch, right? In Streptococcus pneumoniae, what is the drug? Third generation cephalosporin, and if resistant, vancomycin. Meningococcus, third generation cephalosporin. H. influenzae, third generation cephalosporin, right? That is particularly I teach you. So I have taken only that part here which I teach you, because in India if you consider adults, अगर आप adults भी लेके चलें तो adults में meningitis के causes is pneumococcus is equal to meningococcus, and this is particularly above 5 years of age. 5 years of age. Pneumococcus हो, meningococcus हो, both responds to third generation cephalosporin. Okay, that was very good step for us. You are the first student who has said CSA findings were given. It was asked that bacterial meningitis. Very good. अगर bacterial meningitis की picture थी, right? That is third generation cephalosporin. And if pneumococci is resistant, we start is vancomycin. Clear? I have taken this question because this is what I teach to you. So this is third generation cephalosporin plus vancomycin. So therefore the right answer, अगर जो भी picture थी, we also teach you the picture. So this is a picture and this is ceftriaxone plus vancomycin. Very good. I think some students are going to score. This was the question, because this is the question some student has sent me today only, but nobody else has said. Was this a question? Out of the following, treatment for a child with nephrotic syndrome, minimal change disease. Steph Aureus, Nikita, will anybody reply? Was this the question? Was this the question? because I do not know exactly was this the question. If this was the question, we all know in minimal change disease, it is steroids. Minimal change disease is seen between 2 to 6 years of age. The serum C3 level is normal. There is no hypertension. There is no hematuria. Initial treatment of nephrotic syndrome. Staph aureus, was it asked in the children only? And if the initial treatment is asked, of course, it is steroids only. It is steroids. And if it is the first episode, if it is a first episode, particularly, we are giving prednisone. We are giving prednisone 60 milligram per meter square per day for 4 to 6 weeks. 4 to 6 weeks. This is followed by prednisone. This is given daily. This is given daily. Okay, children, so that's a very good percentage. That's a very good percentage, because I always teach you minimal change disease and the treatment. And this is followed by alternate day steroid therapy. Alternate day steroid therapy, that is, we are giving is prednisone now 40 milligram per meter square per day for 4 to 6 weeks. So initial treatment agar pucha tha, so that was a straightforward answer. That is the steroids. That is the steroids here. Diagnosis of UTI in child, best sample is. Yes, it's related to minimal change disease only. Nikita, absolutely right. Will you tell you this? Will somebody tell me, was this the question also? For diagnosis of UTI in a child, what is the best sample? Was this the question? Yes, Nikita, answer is steroids there, definitely. Diagnosis of UTI in child, the best sample is. Right, out of this, the best is midstream, but this single liner question I am doubtful. Matlab, this must have been asked in a different way. Staph aureus, if you can help me. Was this the question there? Was this the question? Right. If this was the question, yes, it was the question. I hope this was a single language given, or it has been to be given. It is midstream clean catch urine. And in the boys, if the midstream clean catch urine, it was more than 10 raised to power 4 colony forming units, it is UTI. In the girls, if it is more than 10 raised to power 5 colony forming units, it is UTI. If in the girls it is 10 raised to power 4 to 10 raised to power 5, we repeat the sample. We repeat the sample, right? So in the child, right, not in an infant, because we assume midstream clean catch urine should be done when the urine holding is, when the urine holding comes, right? Right? Then this was a simple question. Child is having respiratory difficulty after birth. After evaluation, it was found it was a posterolateral defect as shown in the X-ray. What the diagnosis is? What the diagnosis is? This basically is the Bosch-Dallek hernia. This basically is the Bosch-Dallek hernia. If I just show you the picture, although I should have kept picture here only. Just a moment, just a moment. If you basically go here, neonatal respiration, here we go, right? This is actually the picture you can appreciate here. These are the various types of hernias you get in the congenital diaphragmatic hernia. Posterolateral defect is Bosch-Dallek hernia. This is the anteromedial defect, Morgagni hernia. This is the hiatal hernia, which is there. This is the hiatal hernia, it was there, right? Yes, if they mention posterolateral, your answer is what? Bosch-Dallek hernia. Your answer is what? Bosch-Dallek hernia is there, right? This was according to me the questions. Then just now I got some students that it was asked what is the cause of hemolytic uremic syndrome. Was this the question? They have asked here the cause of the hemolytic uremic syndrome. Right? Question number 23 I can make here. Cause of HUS. Cause of HUS, that is the cause of the hemolytic uremic syndrome. If this was the question, and according to some students, the answer, but the question was asked, and the answer of this is Shigella. The answer of this is Shigella. Staff Forest, if you can tell me this was the question. This I have taken the notes from the regular batch. I am just telling because it was really a confusion which questions were generally there or not there. But altogether, if you ask me, if this was the pediatrics question, 2 or 3 questions were really tough for you to answer. At this time, it required a thorough preparation. But the notes which we have given to you, I hope they were more than. So mid-stream urine is sufficient enough. Ankita, that is sufficient enough. And this HUS question was there particularly. Thank you all for coming and watching. You can follow me here, right? And this is the Telegram group for the quizzes. You can join this if you are preparations for your NEET PG now. Hope for a very good result, right? And I hope you all get a very good result, and God bless you all, and stay blessed always. Anything more? I've taken enough of your time. Nobody has told me, was this the question regarding the HUS? Was there this question? They asked this question directly, indirectly it is. Staff for yes. Okay. Okay. That's so nice. We had a very high percentage of questions asked from the pediatrics. Although there were other questions also, steeple sign must have been discussed in radiology also, in the ENT part also. Mitochondrial disorders must have been disorder, right? Then there was a question on the hemangioma part that must have been discussed elsewhere. So directly, indirectly, they asked a lot number of questions. Right? Thank you all for coming, for watching. Right? Just wait for the good results, and we wait for the good messages after the result is there. So with this, I take leave now. थैंक यू सो मच स्टाफ फॉर यस कि पेपर 1 में था. आई होप आपका रिजल्ट आए और आप एक्चुअल नेम से मैसेज करें. यू स्कोर मोर देन 250 मार्क्स. Right? Thank you all. Thank you so much for coming. Thank you all.